Hi there, I'm Dr. Jesse Morse, and I wanted to tell you a little bit about my training and what I do here at the Osteopathic Center. So traditionally, I am family medicine trained, and then I did a sports medicine fellowship. The past couple of years, I was working at an orthopedic clinic, seeing a lot of post-op patients, a lot of fractures. I did a little bit of concussion work. And we saw all different types of knee pain, back pain, traditional cortisone injections, gel injections for the knee, deciding whether patients need oral medicines, they need physical therapy, they need surgery, and then we incorporated a little bit of regenerative medicine into that practice. I have since moved on to here, and here at the Osteopathic Center, I do a little bit of a traditional ortho, in sports medicine, as well as regenerative medicine. So I have one of the benefits of being able to look at an injury and say, all right, here's how traditional ortho would treat it. Here's the other options that we can use with regenerative medicine. And that offers a little bit of a unique perspective because a lot of the old school ortho docs don't really use regen and don't know much about the new stuff. And a lot of the regen specialists weren't officially trained in sports medicine, so they don't understand that part of it and never had any formal physical training, and maybe they don't have ultrasound training. So I do pretty much all my own ultrasound scans. I do most of my injections ultrasound guided. I read x-rays, MRIs. Every once in a while we will order a CAT scan. And we have the luxury of being able to treat this from a bunch of different directions, whether it's you want traditional ortho, maybe you want a steroid injection, maybe you want gel, maybe you want to use the benefits of PT and physical therapy, or you say, no, I don't want surgery, but I also don't want to just kind of kick the can down the road. I actually want to see if we can fix this and maybe heal some of that healthy tissue, and that's when some of that damaged tissue with healthy tissue, and that's when the regenerative medicine comes into it. So we have a bunch of different options there. We have what we call PRP, which is platelet-rich plasma. We can extract stem cells coming out of either your hip or your fat from adipose. You can also use different types of products from either amniotic stem cells or umbilical cord. So there's a lot of different options that we have these days, and whether or not you know what's the right choice, what works, what medium, what's the path you go along. That's what I'm here for. I help to diagnose your injury. I try to explain it to you in layman's terms as best as that we can do. And then I develop a plan for you. And depending on how aggressive you want to be, what your time frame is, and unfortunately, financially, which route you want to take. Traditional ortho, a lot of the times gets covered by insurance, but either if you don't have insurance or your deductibles are crazy high, maybe you don't want to use that. Unfortunately, regenerative medicine is not covered by any insurance. So it's almost always out of pocket. And depending on what you use and the different products that you use, you kind of get what you pay for. So if you want something quality, it's not it's not going to be included in your care under insurance carriers most of the time, and it can add up depending on what you're trying to treat. So we kind of develop a game plan and kind of break it down for you. So A, you know what you're dealing with, and B, what your options are. I almost look at it like a menu. Like I provide, almost like you're at a restaurant. I provide you a menu of what your injury is and what we can do to not only get you feeling better today, but also treat you and prevent it from getting worse or coming back in the future. So a little bit about myself, and that additionally, I'm a little bit of a gym rat. I do live at the gym when I'm not here, so I do get my fair share of aches and pains and injuries, so I understand that part of it. We do treat a lot of professional athletes here, so I understand their mindset and what their goals are, so we can use that. And so we have all different perspectives, and we really personalize the plan. This is essentially boutique medicine at its best, specifically for orthopedics, sports medicine, and regenerative medicine. So thank you for watching.